Good evening, my dear students. Welcome back to Sanskrit Amrit. Dear students, in last lecture we were discussing about the different disease that may occur due to the non-suppressible urges. So here you can read on the screen. Number 12 is Asru. Now Asru means tears. So what happen if the person suppress tears? What types of disease may occur due to the suppression of tears? That we'll study in this shloka, and then we'll understand some treatments also. So let us read the shloka first. Pina sakshi shiro rudgru Pina sakshi shiro rudrung manyastambha ruchi brahma Sagulma baspatastatra swapno madhyam priya katha. Now here you read pina sakshi. So there are two words. First word is pinasa and second word is akshi. Alright. Let me zoom a little bit so you people can read it better. Okay. So suppression of tears leads to number one is pinasa. Now what is pinasa? Obviously running nose. Then next word is akshi, as it is a dirgha sandhi, pinasa plus akshi, so pinasakshi. Akshi means eyes, and shiro rudrunga. Rudrunga is there, right? Where I stopped when I was reading the shloka. I had some doubt because of that very tiny letters. So it is rudrunga, pinasa, akshi, as I said, eyes, shiro is head, right? And rudrungam. Rudrunga. So let me just disjoin these words here, students. First word is akshi, then shiro rudrunga. Second word is shiro, so is actually shiraha, and next word is rud. Rud is heart. And the next word is runga. So what happens, students? Here halanta da is there. This da and this ru both joined, okay, and become dru. So
sir, please share your screen.
Yes. Oh, I'm sorry. I'm so sorry. I just forgot to share. Wait. Alright, I'm sorry, students, I've completely forgot. Now see here, I'll read the sloka again. Pay attention. Pina sakshi shiro rudrung gamanyastambha ruchi brahma sagulma baspatastatra swapno madhyam priya katha. So as I said, here we are discussing about certain disease that may occur due to the suppression of tears. So pinasa, number one disease is pinasa, running noise. Second word is akshi, that is eyes. Shiro is actually head. And rudrunga where rud is heart, right? And here you read runga means pain. So I have disjoined this here. Akshi, shiraha, rud and runga. Eyes, head, rud, heart, and runga is pain. Pain in eyes, head and heart. That also may occur due to suppression of tears. And then manyastambha ruchi brahmaha. Next word is manyastambha, not manyastambha. Why bha? Because next word is aruchi. Manyastambha is actually the stiffness of neck. Alright. And aruchi, dirgha sandhi, manyastambha plus aruchi. Aruchi, we know this. In the previous sloka also we have come across this word, aruchi, anorexia. And brahmaha is giddiness. Alright. So these may occur. Then more sagulma. So sagulma is gulma. Gulma is abdominal tumor. Right. You must have heard this word gulma. That is there in the abdomen. So abdominal tumor, it is called gulma. Sagulma with gulma. So meaning is that abdominal tumor also may occur due to the suppression of tears. Then next, baspatastatra. Baspatastatra, while you read this word, you will find two different words. Baspatastatra. Let us disjoin first. First word is Baspatah, and next word is Tatra. Now students, here this visarga of Baspatah changed to Halanta Sa, dental Sa. This is because of Visarga Sandhi. Alright. So basically the word is Baspatah. Now students, Baspa, I'm sorry, this, Baspa means actually the tears, and Taha means due to or from. From tears means due to the suppression of tears. Alright. So I'm sorry, here the Sa should be cerebral Sa. Yeah. Bashpa, as I said, tear, and Baspatah, due to the tears, means due to the suppression of tears, this all disease may occur. Now, Tatra, this is an indeclinable avyay, that means there. What is the meaning of Tatra? There. Now, students, let me advise you, tell you something very important thing. This Tatra is indeclinable avyay, and in exam there is a specific grammar topic named avyayani. Now in avyayani you will find around 40 different avyay, 40 different indeclinables. In exam, how the questions will be asked? In exam they will give you a shloka or a sentence in which this kind of avyay is given, and they will ask you, now it is asked in the exam to you that to tell the contextual meaning of that avyay. No? Contextual in reference to context. What is the meaning of this avyay in this shloka with the contextual meaning? So here you read Tatra is given, the meaning of Tatra is there. There means where? In this all disease that we already discussed, that may occur due to the suppression of tears. In this all disease, so the meaning of Tatra here is in this all disease. This is called the contextual meaning of this Tatra. So, Tatra, as I said, there in this disease. Swapno. Swapno word you read here, but it actually Swapnaha. Swapna means sleeping. Right? Which types of treatments are best in this disease? Then number one treatment is Swapnaha, sleeping. Right? Second is Madhyam, drinking alcohol. However, this is not the advisable thing for as a treatment. But Madhyam, drinking alcohol is also one of the treatment that you can have. And then Priyaha Kathaha. Priyaha Kathaha as the stories of the pleasant stories that you can say. Alright. So hearing pleasant stories also one of the best treatment while you are suppressing the tears and these types of different disease are occurred. Alright. So in this shloka we understood the names of the disease, and we understood that different types of treatments also we can have. Here you read in the treatment sleeping, drinking alcohol, company of the friends, and obviously the hearing the pleasant story. Here Priyaha Kathaha is written. So you can translate that Priyaha as pleasant and Katha as stories. However, they haven't mentioned anything about the friends, right? But obviously we know, students, while we are actually, sometimes in our life we are facing some such situations that we are very much in grief, but we are not expressing our tears, our grief in the society, in front of some unknown people. At that time, what we are controlling our emotions, we are not crying. And especially it is seen in men comparing to women. Some days, sometimes women also trying to, control that emotions of tears. But that actually leads to the different disease that we already studied today. So try, please not just suppress these things, tears and all. Just cry. If you are not able to cry in front of the crowd, stay away, be alone and cry. And normally we see this kind of things that people just being alone and they start crying. But don't suppress. It is not advisable. Alright. Now let us understand about the next sloka, that is about the chardi, right? Vomiting. What happen if you are trying to control vomiting? However, it is next to impossible. We know that we can't control our vomiting. Even then, because of some kind of a places where very neat and clean place is there, and we would not like, obviously we would not like to just spoil that place, and we are trying to avoid that vomiting. In this situation, many different diseases may occur. So let us understand. Number one, here the sloka is there. विसर्प कोठ कुष्ठाक्षी कंडु पांडवा मयज्वरः सकाशश्वासरुल्लास व्यंगस्वयथवो वमेः. Next sloka continues about the Chardi. गंडूष धूमानाहारा रुक्षं भुक्त्वा तदुद्वमः व्यायाम श्रुतिरस्रस्य शस्तं चात्र विरेचनम् सक्सार लवणम तेलम अभ्यंगार्थम च शस्यते. Now these 2.5 sloka you read here, these all slokas are for Chardi. What type of disease are occurred, what type of treatment that we can have, let us understand. Here they said Visharpa Kotha Kushthakshi, suppression of urge, right? Suppression of urge of the vomiting leads to, number one is Visharpa. You can read Visharpa as erysipelas, and then number two is Kotha. Kotha is urticaria, and then next Kotha is one type of skin disease, I think, and then Kushthakshi. While you disjoin this Kushthakshi, you will find two different words, Kushtha plus Akshi. Kushtha is one skin disease, skin disorders, and then Akshi we know as eyes. So Oxy roga, right? Eyes disease. Then next is Kandu, itching. What is the meaning of Kandu? Itching. You can read it clearly. Next we have Pandva Maya Jvaraha. Students, Pandva Maya. Don't get confused with this Pandva Maya Jvaraha. Let me just disjoin this word. There is a Yana Sandhi, Iko Yanachi Sootra. So the first word is Pandu, and next word is Amaya. Now listen to me carefully. Here this word is ending with U. Do is ending with U, and next word starts with A vowel. So what happened? This U that you see here, let me just disjoin. This U will be converted to Halantava as per Yan Sandhi. What is the Sandhi rule here? Yan Sandhi rule is there, right? That converts U to Halantava. So U is converted to A, and while you join them all, it will be like Pandva Maya. Pandva Maya. Now let me tell you, Pandu is a name of a disease, and Amaya means disease, right? Roga. Amaya is the synonym of Roga. So Pandva Maya as Pandu, anemia, and Amaya as disease, right? And next disease name is given here as Jvara. Jvara means fever. So all these disease occurred. More disease are given here in this second part of the sloka. Sakasha. So kasa is there. Kasa is cough. Okay. Next is Shwasa. Shwasa we can see here dyspnea. Then Rullasa. Rullasa, the first word is Rut and Lasa. So in short, Rullasa together as nausea. Then next word we have as Vyanga Swayathavo Vamehe. Vyanga. So next word is Vyanga. Vyanga as discolored patches on the face. And then Swayathavo. Vyanga, then Swayathavo. Now don't get confused with this word. What is the word here written? Swayathavo. Let me tell you Swayathavo word. Actual word is Swayathu. What is the word, students? Swayathu. This is first case singular. Now students, you all have studied O ending word, E ending word, right? U ending word, all these words you studied. Here it is U ending word, Swayathu. Aparna, are you able to see the screen?
Yes, sir.
Alright. So swayathu is actually ending with u. U ending word like sadhu, bhanu, right? Now, while you see the plural form, while you check the forms, table forms of swayathu, it goes like swayathuhu, swayathuhu, swayathu, swayatavaha, right? So the plural of this swayathu will be swayatavaha. Now visarga sandhi, as per visarga sandhi, visarga converts to u, and ultimately va and u joined and become vo. So that's why you are reading swayathavo. Plural form of swayathu is given. Now what is swayathu? Obviously sneezing. Oh, sorry. Oedema. So swayathu is one type of disease. Here the plural form is given because so many different diseases written together here as one samas, and that samas name is called Dvandva samas. Why? When more than one word, two word, three words written together, right, and all are coming from the same category words, then it is called Dvandva samasa. And what is the rule of Dvandva samas? The last word of that group, right? Here you read kasa is there, swasa, rullasa, vyanga. In this last word is swayathu. So last word always must be written in the plural form. So that's why here the root word is swayathu as first case singular. But in the sloka you find plural, swayathavo. It does not mean many odema, many disease like this odemas. No. One swayathu word is only mentioned here. But it is plural because of Dvandva samas, where more than two words are there, then the last word should be written in the plural. So one by one all you should take, and last word is representing all the words as plural number. Now next word you read as vamehe. What is the last word? Vamehe. So actual word is vami. What is the actual word, students? Vami. Let me write here. Now any guesses what should be the meaning of vami here? Arpana, if I'll ask you, any idea? Vami. Actual word is vamihi, like matihi, buddhihi, prakrutihi. This is the root word. The meaning of vami is, yes, meaning of vami is vomiting. This is a synonym of chhardi. So here they used vami. Vami means chhardi, and the meaning of vamehe is due to the chhardi, due to the vomiting. So due to vomiting, due to the suppression of vomiting, all these disease that you read, we already studied in this sloka, that may occur. Now, what type of treatment that a person can have? Then here it is written in the 18th sloka. See, Gandusha Dhumanahara. So number one is Gandusa, right? Mouth gargling. That is also good treatment. Second is Dhumanahara. So Dhumanahara, where two words are there. First word is Dhuma. What is the first word? Dhuma. Now Dhuma is fume. So Dhuma Pana, they would like to say. Dhuma Pana, inhalation of medicated fumes, right? That is the second. And then next as Vamana. Next treatment is Vamana, induce vomiting. So Dhuma and Anahara. So here sometimes you could get confused by reading this word Dhuma Nahara. Let me teach. Dhuma Nahara. Students, some words are very easy to understand as it is given in the sloka. Sometimes some words that you need to check how exactly the meaning is coming out. Now see, next here it is Dhuma Nahara. You can disjoin Dhuma plus Anahara, right? It's very obvious. Dirgha Sandhi. Ma plus O becomes Ma. Okay. Now Dhuma is fume, right? Inhalation of medicated fume is Dhuma. But Anahara means what? Anahara, this is actually the opposite of Ahara. Am I right? And I already taught you this, that in Sanskrit language, if you see a word starting with a vowel sound, here Ahara starts with a vowel sound. So the opposite of this vowel starting word, you will have to do it with an prefix. Okay, so now while you added an and ahara you join, it will be anahara. So it is an opposite of ahara. Now what is the meaning of ahara? Ahara means food, means taking food, consuming food. But if you put opposite, anahara means opposite of consuming food, means vomiting, taking it out. Alright, so that is how the meaning of this dhuma and anahara is given. Dhuma is inhalation of medicated fumes. Second, anahara is vomiting. Alright, that's why anahara you should take the synonym of vamana, induced vomiting. Alright, next, ruksham bhuktva tadudvamaha. Ruksham. Ruksham is actually dry. So after consuming dry foods, right, you can have that vomiting, but after eating ruksham, dry foods, right? So after bhuktva means after eating, ruksham means dry, and tadudvamaha. Tadudvamaha as tad udvamaha. So it you can consider as vomiting also. So one should have the dry foods and then do vomiting, vomana. So that is also one type of very good treatment for all the disease that occur due to suppression of vomiting. Then next treatment they have given as vyayama, right, exercise. Then next, shruti rasrasya. Shruti rasrasya, here first word you read as shrutihi. What is the first word? Shrutihi. And here you read ra is given. This ra is actually the visarga. So shruti rasrasya, while you disjoin, you will find two different words like this. Shruti rasrasya. So let me disjoin. First word is, as I said, shrutihi. Okay, shrutihi, visarga is there. So as visarga changed to halantara, what should be the next word? Aparna, any guesses from your side? If I will ask you to disjoin shruti rasrasya, first word is shrutihi, then what should be the next word? Starts with. Here I can give you hint. This visarga changed to halantara. So next word should be okay. Actually next word starts with a, right? Asrasya. What happens actually here, this word, previous word was ending with visarga, and this visarga gets changed to ra, halantara, and halantara and a both joined become full ra, right, with a sound, rasrasya. So actual two words are there. Which two words? Shrutihi and second word is asrasya. Now students, visarga sandhi rule is applied and visarga changed to ra. So the meaning of shrutihi, you can see meaning of shrutihi plus asrasya. So shrutihi is actually rakta mokshana. Asrasya is blood. What is the meaning of asrasya? Blood. And shruti is letting, blood letting. So you can take together shruti rasrasya. Asrasya shrutihi you can take like this. Meaning, swipe this word. Shrutihi you can take at the end, second word, right? Asrasya shrutihi means blood letting. So that is also one of the treatment. And next, sastam. Sastam chatra virechanam. Actually the meaning of sastam is best, right? The good, the beneficial. And chatra, cha plus atra, disjoin, cha plus atra. Cha means and, atra means here. Both are indeclinable. So here, what is the best treatment? All these are the best treatment. And one more they mentioned, virechanam. Virechana, you must have heard about this virechana, students, right? Purgation. So this purgation you can take as one treatment. Then few more. Saksara lavanam telam abhyangartham cha sasyate. As I said, the meaning of sastam here is beneficial, is good, advisable, right? Sasyate is also advisable, it's good, beneficial. But here, what is beneficial? Then here this word. Sakshara lavanam telam abhyangartham. Students, we all know kshara means alkaline. What is kshara? Alkalis, right? Sakshara, alkalis, right? Here you read the body massage with oil mixed with sarajaksara, that alkalis, and sandhava lavana means rock salt. So sakshara you can consider as alkalis and lavanam is rock salt. These both, with these both, telam abhyangartham. So two words. First word is telam, second word is abhyangartham. So you should use oil mixed with these two things. One is sarjaksara, alkalis, and second is lavana, sandhav lavana, that is rock salt. That oil should be used for abhyangartha. What is abhyanga? We know abhyanga is massage, body massage. So having body massage with oil and mixed with these two, this is also advisable, this is also beneficial. Here you read sasyate. So in the translation as it is given, body should be massaged with oil mixed with sarajaksara, alkalis, and second is sandhava lavana, rock salt. So that is what the advice given, students, for the treatment of the disease that may occur due to the suppression of vomiting. Now next, number 14, as you read, semen. Sukra means semen. So the shloka number 19 and 20. Just a second, dear students. Yeah, so slok number 19 is Sukra tatsravanam guhya vedana swayatujvaraha. Half part of the 19th sloka is given, and then 20th sloka Rudvyatha mutra sanganga bhanga vrudyasmasandhataha tamra chuda surashali बस्त्यभ्यंगा वगाहनम बस्ति शुद्धि करे सिद्धम भजेत क्षीरम प्रिया स्त्रियः. Dear students, suppression of semen leads to number one is viryasrava, increased flow of semen often. Sukrat tatsravanam. Sukrat tatsravanam. First word is sukrat. Can you see double ta is there? Let me zoom. Yeah, here double ta is there. So first word is ending with halantata, sukrat. Sukrat means due to semen, due to the suppression of semen. Tat, of that. Sravanam means flow, right? So if a person is suppressing the semen, then the first side effect or first disease you can consider as viryasrava, means increased flow of semen, right? Increased flow of semen. So that is called sukrat, due to semen suppression. Tat sravanam. Sravanam is flow. Then second, guhya vedana. Guhya vedana is pain in the penis. Guhya vedana, pain in the penis. Then next is swayathu jvaraha. Second, here they explain the word swayathu. Swayathu is odema. Then next is jvaraha, we know as fever, also can be there as the disease. Then here the next line, students, you have to pay attention as it is a little tough shloka in terms of pronunciation and the words. What is the word? Rudvyatha mutra sanganga. Rudvyatha mutra sanganga. Let me write it here. Rudvyatha. So what happens? Halanta da is there. And second word is vyatha. Combination of halanta da, va and ya together is there. Rudvyatha. So first word is rud. Okay. First word is rud. that is heart. Vyatha means pain, cardiac pain, Rudvyatha. Okay, this is also one side effect. Then Mutra Sanganga Bhanga. So Mutra is urine. So Mutra Sanga is anuria. And here you read Sanga is there. Here Sanga is there. Why? Because Dirgha Sandhi. Next word starts with Anga word. So Mutra Sanga as anuria and next word is Anga Bhanga. Now we know Anga is body parts. Bhanga is splitting pain. So Anga Bhanga is splitting pain all over the body parts. Right? Body. Then Anga Bhanga, after that Vrudhyashma Sandhataha. Vrudhyashma Sandhataha. See students. Vrudhyashma. You have to disjoin this Vrudhyashma, two words. If you would like to note down, please note down. In exam, if this sloka is asked, right, in future, then it will be helpful for you to disjoin these all words. Vruddhi, Vrudhyashma Sandataha. So Vruddhi plus Ashma. Next word is Ashma. And then next word is Sandataha. Three words we have. What happens here? This Vruddhi and A joined and Yan Sandhi is applied. If you remember here I said Yan Sandhi converts E vowel to Ya consonant and U change to Va consonant. So E changed to Ya. That occurred here. See. Vruddhi. This E is converted to Halant Ya and A joined. Vrudhyashma. Now Vruddhi means growth and Ashma is actually the stone, right? So sometimes we are having some problems in the bladder because the bladder stone is there, right? So that is what they are explaining here, that Anga Bhanga we understood. Then next Vrudhyashma Sandataha. So you read here students, Vruddhi as Vardhma word they have given. Vardhma as pain in the scrotum. So Vruddhi as you can consider as like growth, increasing. But here Vruddhi in the contextual meaning they said as Vardhma means pain in the scrotum. And then you read Asma as I was talking. Asmari means stone. Right? Bladder stone we have, kidney stone we generally people have, right? So Asma as Asmari as stone, okay? And then next word is Sandhataha. Sandhata means importance, right? Importance. Also some people are struggling with this importance due to the suppression of semen. Sometimes they may struggle with this kind of disease also, importance. So these all are the disease, and now we will understand what type of treatment that a person can have. Then they said you consume a food with like chicken, alcohol and red sali rice is advised, right? All this kind of food is advisable. So here you read students Tamra, Chuda, Sura Sali. Tamra Chuda you can consider as Chuda is actually the chicken, right? And Tamra you can consider as red, right? So red color or Tamra Chuda you can consider as chicken also. So number one chicken. Then Sura Sali. Sura is alcohol. What is the meaning of Sura? Alcohol. Then Sali. Sali is sali rice, right? But red sali rice. All these things, this food is advisable. Then in treatment, here you read Bastya Bhyanga Avagahanam. Bastya Bhyanga. Three words are there. First word is Basti. Yan Sandhi is applied. E is converted to Ya. So the first word is Basti. Basti, medicated animata. Then second is Abhyanga. Dirgha Sandhi. Abhyanga plus Avagahanam. Abhyanga is body massage, right? We know. And Avagahana is tub bath. So first they were discussing about certain food to be taken, and then they explain about certain treatment that a person can take, like Vasti, Abhyanga, and Avagahana. More than this, they are advising about Basti Shuddhi Karehi Siddham Bhajes Kshiram Priyaha Striyaha. They said that a milk processed with drugs. See, Basti Shuddhi Kare. Shuddhi Kare means processed. Right? Siddham Bhajet means one should consume, one should use. Kshiram means the milk. So the milk that is actually processed with the drugs, right? That also should be consumed. And then priyaha striyaha. So why they have advised to take the milk processed with the drugs which are good for urinary bladder. Okay. So basti suddhi, as you read, basti suddhi means that cleans the basti, right? So that's why it is advisable to take the kshir, means the milk, right, processed with the drugs, right? Not just clean pure milk you should take. No, take milk with drugs. So that is beneficial for urinary bladder also. That should be taken budget, as you should take or you should consume. And then priyaha striyaha, sexual intercourse with the women best liked, right? So all these are the advices and the treatment that a person can take if he or she is struggling with the disease that may occur due to the suppression of semen. Alright, so students, till now we understood about some non-suppressible urges that a person should not suppress, and if the person has to suppress it, and if he or she is struggling with the disease, we have understood about the different treatments also. Now here, a person who is not eligible for the treatment, students, then let us read the sloka. Trutsulartam tyajet kshinam vidvamam vegarodhinam. A person habituated for suppressing the above natural urges and suffering with the complications like fecal vomiting. Actually, it is yes, fecal. So fecal vomiting should be written. There is a spelling problem. So fecal vomiting. Then emaciated, severe thirsty, and pain abdomen are not eligible to get treatment. So here you read number 1, Trut Shulartam. Students, trut is actually thirst. What is the meaning of trut? Thirst. Then next is Shulartam. Shula plus artam. Shula is pain, abdomen pain, right? And artam is actually the, you can say, as the patient, right? One who is struggling, right? So the patient who is having thirst and who is struggling with the abdominal pain, tyajet. Tyajet means one should avoid it. He should not be treated. Students, tyajet, while you read this, let me remind you again. I would like to learn these things, that tyajet is actually one of the lakar, that is Vidhiling lakar. Vidhiling lakar. And what is the meaning of Vidhiling lakar, students? Lat lakar, every one of you knows. Lat lakar is present tense. Lut lakar is future tense. Lang lakar is past tense. This is a special lakar, that the meaning of this lakar is should and would, or potential mood. That is, it is actually the potential mood. Means one should do this, one should not do this, right? Should and would. So advice is given specially by using this lakar, this tense. So tyajet is actually pratham purush ekvachan. Now why I am mentioning all these things, students? Because in exam you will have to explain all these things in 10 marks question, right? While this sloka, suppose it is asked, so you have to mention that tyajet is Vidhiling lakar, pratham purush ekvachan, all these things. And this is not something that you can just mention here and write. You can easily learn this, as it is a part of your grammar topics. In term 1, I already explained you about the dhatu roop, verb forms, in which 5 different lakar I explained you. present tense, future tense, past tense. Then lot lakar, it is imperative mood. And the fifth, vidiling lakar, that I explained, that is potential mood. All these 5 lakar are compulsory to learn, not in terms of just explaining this in the sloka, but a specific question will be there in the question paper where they would ask you any root verb. They would ask you, for example, kshi dhatu, right? Kshi means to get destroyed, right? So you have to write all the verb forms of present tense, past tense, lat lakar, lut lakar, lang lakar. So my advice is to learn only 5 lakar of any dhatu. Or first your priority should be to learn the root, the suffixes of each tense. I taught you in the sloka. You just get back and see the videos of dhatu roop. I taught ti, taha, anti, only the suffixes. So if you will learn only suffix, it will be easy for you to prepare any verb forms of any root verbs. And it is good for you if you have this knowledge. It's very obvious that you can easily mention, if it is used in the sloka, you can easily mention, okay, this verb form is this lakar, and this purus and this vachan. Purus means the person, vachan is, you know, this number. So multi-dimensional uses we have of this lakar, right? So please learn it for specific question in exam, and learn it for explaining as it is coming in the sloka, right? It will be a 10 marks question. You will have to explain everything about the meaning of each word, about the anvay, about vibhakti, about sandhi, about samas. So students, please study this verb forms also. So as I said, tyajet means one should avoid, the person who is struggling with thirst and abdominal pain. Then next, kshinam. Next word is kshinam. Kshinam is actually you can say as very weak, right? Or one who is one who is struggling, right? So that is kshinam, and one meaning of kshinam means decreasing, right? So that is the meaning of kshinam. And then we have vidvamam. Now students, wheat is actually feces. What is wheat? Feces. And vamam is vomiting. So here, as you read, fecal kind of a spelling is that actually feces vomiting, right? That is also kind of a disease that also a person is doing. Then vega rodhinam. Vega is urges, and rodhinam means suppressing. So a person who suppress the urges, right, and struggling, and he is suffering with different complications like feces vomiting, then suffering with thirst, suffering with abdominal pain. So he is not eligible to get any treatment. So he should be avoided. He should not be treated. Tyajet. One should just leave. The doctor should not treat him, right? So please, we should teach our patient in future that never ever suppress the urges, right? Any natural urges. That is what the moral of this sloka given. Then next we have the factors responsible for the manifestation of all the disease. However, we understood so many things. So the moral of these all slokas is that one should never suppress the non-suppressible urges, right? So that is what given in this sloka also. Roga sarvepi jayante vego dirana dharane. Roga sarvepi. Students, sarvepi roga, you should understand. Sarve means all, roga means disease. All the disease. Jayante means manifested, right? All the disease occurred. You can translate jayante as manifested or occurred. All the disease may occur due to these words. Now what is these words? Vego dirana dharane. Now two words are there, vego dirana. So students, disjoin this word. First word is vega, and second word is udirana dharanehi. Vega is actually the urges, right? Now urges, second word is udirana. So udirana is forceful expulsion, forceful expulsion, and dharana is suppression. All right. So let me just type these words and you can understand it even more clearly. Vega, udirana, dharana. So students, Vega we know as natural urges, right? Udirana as expulsion, and dharana is suppression. So if the person actually forcefully he does the expulsion of these urges, and voluntarily he suppressing these all urges, then all these disease may occur, will be manifested. So that's why here the translation is very clear. All the disease will be manifested due to the two things. Number one, forceful expulsion, that is udirana, and dharana is voluntary suppression of what? Natural urges, that is vega, right? So that is why we shouldn't do the expulsion and suppression of these urges. Okay, now general line of treatment given in this slogan number 22. Let us study about this. General line of treatment, students. Nirdishtam sadhanam tatra bhuyishtham ye tu tan prati tatascanekadha praya pavano yat prakupyati annapanoshadam tasya yunjitato nulomanam. Effects of the suppression of natural urges and their treatment have been explained till now. Till now we understood, no, all types of disease that may occur due to the suppression of natural urges, and we understood their treatment also. So that is what given in this first line. See, nirdishtam explained. What is the meaning of nirdishtam? Described, explained. Sadhanam means the treatment. Tatra means there. So there of all these, bhuyishtam means the best. The best treatment of this all disease that is explained to tan prati. Tan prati means towards them, means towards the disease. Okay. So all the disease and treatment towards them, all these things, nirdishtam means described, explained already now, till now. Now here, tatascha nekadha. Students, tatascha nekadha you have to understand. Tatascha nekadha. See, first word is tataha. Can you see this sha is actually visarga? Let me just put it in red color. This sha is actually visarga that gets changed to palatal sha because of visarga sandhi. Actual word is tataha. Tataha means after that. Once we already explained what Vagbhat said, the great Vagbhat said that we already explained about the different disease that occurred due to the suppression of different things, urges, and the treatment also we understood, we explained. Now here tataha, after that chanekadha. Now chanekadha, here cha plus anekadha. Cha plus anekadha. So it is a dirgha sandhi. We already know a plus a is equal to a, right? Anekadha means different types of. After that, and after that, different types of what? Prayaha, mostly. Pavano yat prakupyati. Prayaha, mostly. Pavano means vata, vayu. Yat prakupyati. Most of them, this disease occurred due to the vayu, due to the vata. So here, since vata is provoked by various causes and in multiple forms everywhere, select foods, drinks, food substances aiming at the pacifying the doshas as well as the downward movement of vata. This is the basic principle for treating the disease. So students, here we understood that vata is actually the main reason in this all the disease. So tataha, after that anekada, most of them disease prayah mostly occur where the vayu pavana is prakupyati. Prakupyati is provoked. What is the meaning of prakupyati? Vitiated. You can consider as provoked or vitiated, and that is because of various causes. Why vayu is this vitiated, provoked? We know vata, pitta, kapha. All three dosas are actually vitiated, provoked due to the some causes, right? Internal, external factors, right? We already understood about different types of disease, agantuja and your own like nija. So nija and agantuja, two types of disease we have. So this vata, pitta, and kapha, these all. Here we are talking about only vata. So vata is actually provoked due to or by various causes and in multiple forms everywhere in the body. Alright. So that is what explained in this line. And then anna panaushadham. Anna is food. Panaushadham. Vruddhi sandhi. Pana plus aushadham. Pana is drinking. Aushadham is actually the medicine. So select food. Anna. Pana is drinks. And aushadham is food substances. Right. All food substances, ginger and other substances that can be useful as drugs, as medicine. So all food substances, that is aushadham, all these three should be selected properly. And tasya yunjitato nulomanam. Tasya, of that disease, yunjitato nulomanam. Yunjitato, disjoin this. Yunjita plus ata plus anulomanam. Yunjita means should be used. What is the meaning of yunjita, students? Should be used. What should be used? Anna, pana, ausadam. Food, drinks and food substances should be used in such a way so that vayu, that vata, anulomanam. Anulomana, so that dosa, that vata, that should go downwards, right? Because here you read, we should take these all food, drinks and food substances with which aiming at pacifying the doshas as well as downwards movement of vata. Pacifying the doshas plus downward movements of vata. So anulomana is actually downward movement of vata. So for all these things one should utilize, this is called a general treatment, general line of treatment. They have already explained about all the disease and they have given about the treatment, all the advices they have given. But here in general line of treatment in this sloka, what they said, that the only vata is provoked because of different reasons, because of different causes, right? So better you take such kind of food, drinks and food substances so that pacifies the doshas and downward movements of vata is also possible, and this is considered the basic principle for treating the disease. So that is advisable in general. Alright. So here they explain about the general treatment of disease. Now from here if you read, Dharaniya Vega is given. Dharaniya Vega. Till now we were understanding, we were learning about the Adharaniya Vega, non-suppressible urges. But here you read Dharaniya, means suppressible Vega, suppressible urges. So that we will start from the next part of the video, students. In the next lecture I will start explaining about this Dharaniya Vega from sloka number 24. Till then, take care of yourself, students. Just want to advise, just not advise, but just would like to inform you, once we'll finish this chapter, we'll start term 2 syllabus. Alright, you people are coming from different colleges around India, right, in different states. So please ask your professors, Sanskrit professors, that NCISM has already prescribed the syllabus, right, and I'm teaching as per that. So what types of syllabus is being taught in your college, what kind of the syllabus is taken in the periodic assessment, in term 1, in term 2. Accordingly you study. I will not leave a single thing. I am completely following the syllabus prescribed by NCISM. Why? Because all of you are having maybe one topic less or some other topic is included. So better if I will teach, if I will cover all the topics of all terms, then you can study that all. But you take advice, be aware, ask your friends about the syllabus, about syllabus of periodic assessment PA1, PA2. In different colleges, different periodic assessments are taken in different forms, in various forms, right? So accordingly you get ready and study well. All right, so that is what something that I would like to share with you. Thank you all for being, and we'll be meeting in the next video. We'll understand about the dharaniya vega, suppressible urges. All right, thank you all. Bye bye, take care.
Thank you, sir.